Hello everyone. Welcome to today's live presentation. Today I am going to speak about an interesting topic, and that is ImmuLIT is not alternative medicine and what is the science behind it. I am Dr. Mohan Raut. I am a gynecologist and clinical reproductive immunologist certified by the American Society for Reproductive Immunology. We have our centers, Dr. Raut's Centers for Reproductive Immunology in Mumbai and in many other parts of India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility with our patented and branded process of ImmuLIT treatment. So, reproductive immunology is still often grouped with unproven add-ons, but we need to be precise about what we are doing and why that distinction matters to us clinically. Many of us have seen this patient. There are good embryos, technically sound embryo transfers, everything reported as normal and yet no implantation. At that point, the question is no longer embryology. It is whether we are missing a biological factor. So, in clinical practice, interventions like intravenous immunoglobulins, intralipids, steroids, and even lymphocyte immunization therapy are often placed under one umbrella, and that is of immune therapy. But this is scientifically inaccurate because they do not act through the same mechanism. And when the mechanism differs, the indication as well as the outcomes will differ. So the first step is clarity. Passive immunomodulation such as IVIG, intralipids, and steroids, they work by temporarily suppressing or modulating immune activity, whereas active immunomodulation, which is what ImmuLIT or lymphocyte immunization therapy represents, works by training the immune system. This distinction is not academic. Mind you, this is clinical. In a subset of patients, particularly those with repeated implantation failures or recurrent pregnancy loss, the issue is not an overactive immune system, but a failure of immune tolerance, specifically inadequate production of blocking antibodies. In a normal pregnancy, the maternal immune system recognizes the embryo as semi-allogenic and develops tolerance. But in these patients, that tolerance does not develop adequately. ImmuLIT treatment works by exposing the maternal immune system to paternal lymphocytes, stimulating the production of protective, tolerance inducing antibodies. So, we are not suppressing the immune response, we are correcting a missing response, you can say that. Now, let's come to ImmuLIT specifically. It is a lymphocyte immunization protocol, a single sitting procedure of approximately 3 hours, and it is individually designed rather than standardized, making it a targeted immunological intervention rather than a general add-on. It is not for every patient, but in the right patient, those with repeated implantation failures, recurrent pregnancy loss with suspected alloimmune causes, or selected unexplained infertility. It becomes highly relevant in these patients, and the key is patient selection based on mechanism rather than protocol. You must be aware lymphocyte immunization therapy has been studied for over 3 decades now. And within the field of reproductive immunology, there is a lot of work being done, and the work published is published in journals such as Human Reproduction and the American Journal of Reproductive Immunology. The contributions from researchers like Dr. Alan Beer or Dr. Gilmore, they have shaped our understanding of immune tolerance in pregnancy. So organizations like American Society of Reproductive Medicine or ASRM or the European Society, that is the ESHRE, both have emphasized careful patient selection and interpretation in these cases. The American Society for Reproductive Immunology has come out with their own guidelines on use of immunomodulation in recurrent pregnancy loss, and they're coming soon with guidelines in recurrent implantation failures. So the conversation is not about belief, it is about appropriate application of immunology. Even the mechanism of action of ImmuLIT is now very clear. After the lymphocytes are injected into the skin, they are picked up by the dendritic cells in the skin and are presented to the secondary lymphoid organs. Here, the immune interaction leads to formation of T memory cells and B memory cells. Later, when these memory cells are exposed to pregnancy, they undergo what is known as clonal expansion, and B memory cells produce protective antibodies and T memory cells produce T regulatory cells, inducing immune tolerance and thus protecting the pregnancy. So think of your last difficult case again. Good embryos, multiple failed transfers, everything normal. And ask whether immune tolerance was ever evaluated. Because if the underlying issue is alloimmune, repeating the same cycle may not change the outcome. So, in conclusion, ImmuLIT is not alternative medicine, but there is science backing it. It represents active immunomodulation distinct from passive approaches and applicable in specific clinical scenarios. And finally, when the biology is immune, the intervention must be immunological. So, for more information, case discussions, or referrals, you can reach us on 98201 83757 or 98208 94047 or 9833201500. You can also visit our website www.icprm.in. So, do write about your queries and we will personally solve your questions. And if anytime you want more information on any other topics in the field of reproductive immunology, do write to us. We will cover it in our live presentation. Thank you.